Namaste, good evening. This is Dr. Aparna. I am an Ayurvedic neuropsychotherapist, a passionate Ayurveda, psychotherapy, neuroscience, and Bhagavad-Gita infopreneur, medical writer. I have voiced my pursuit as Global Neuro Mind Veda, wherein we discuss, uh, you know, Ayurveda, neuroscience, psychotherapy, and Bhagavad Gita. In the previous session we were discussing on neuroplasticity, and this session, after that session I got many inquiries on psychological resilience or resilience psychology. So I thought I would answer those questions today. So let's understand what is resilience psychology. See, resilience psychology, as the word itself suggests, resilience is bouncing back. So, in simple words, you can consider it as a guide to bouncing back. So, psychological resilience is often referred as grit or mental toughness. That means it is the ability to adapt to adversity, to bounce back from setbacks and thrive in the face of challenges. So, it is a mindset that enables individuals to cope with stress, maintain optimism, and continue to function effectively even under difficult circumstances. So, it is nothing but grit or mental toughness. So, let's understand what are the key components of resilience psychology. So, first thing is, positive outlook. So, maintaining a hopeful perspective, even in the face of adversity. Second thing is optimism. So, believing in positive outcomes and expecting the best. The next thing is self efficacy, having confidence in one's abilities to cope with challenges and achieve goals. Next is problem solving skills. So, being able to identify and address problems effectively. Next is social support. So, having strong relationships with others who provide emotional support and encouragement. Next is flexibility. So, being adaptable and able to adjust to changing circumstances. Next is stress management. So, developing healthy coping mechanisms to manage stress and anxiety. So, mainly, what all we discuss in resilience psychology is positive outlook, optimism, self efficacy, problem solving skills, social support, flexibility, and stress management. So, what are the some examples of resilience in action? So, first example is something we can consider overcoming a trauma. So, individuals who have experienced traumatic events such as natural disasters, violence, often demonstrate remarkable resilience. That in they are bouncing back from that setback. So, by rebuilding their lives and finding meaning in their experiences. Next example is adapting to change. So, people who successfully navigate career changes, relationship breakups, or relocations, often exhibit resilience by embracing new opportunities and challenges. So, the third example is persevering through adversity. So, for example, athletes who overcome injuries or setbacks to achieve their goals, or students who persist through academic difficulties. So, these are the examples of individuals who demonstrate resilience. So coping with chronic illness, so people with chronic illness who maintain a positive outlook, manage their symptoms effectively and continue to pursue their goals, are demonstrating resilience. So these are some examples of demonstrating resilience or resilience in action. So, how do we cultivate resilience? I am just going through brief, on how do we cultivate it. We will discuss this in detail as well. So, see, while resilience is often, seen as a trait, resilience is often seen as a personality trait. But the good news is, it is not just a personality trait, it can also be developed and strengthened. So how do we cultivate resilience? So by first thing is by practicing mindfulness and meditation. So these techniques can help reduce stress and improve emotional regulation. So next is building strong social connections, so having a supportive network of friends and family who can provide emotional support and encouragement. Next is setting realistic goals. Breaking down larger goals into smaller, achievable steps, can help build confidence and motivation. So you when you break down your goals, your larger goals into smaller goals, into achievable steps, that also can help build confidence and motivation. Next is learning to manage stress, so developing healthy coping mechanisms such as exercise, so relaxation techniques, hobbies, skills. Next and most important thing is focusing on gratitude. So practicing gratitude can help shift your perspective and focus on the positive aspects of your life. Usually what we do is we always tend to regret for the things we do not have, but we really do not practice gratitude for the things we have or things we own or people we have. So focusing, you when you practice gratitude, then it helps, it can help to a greater extent to shift your perspective and focus on the positive aspects of your life. Next is seeking professional help. If you're struggling to cope with some adversity, seeking therapy or counseling can provide valuable support and guidance. So, next is we have to discuss, when we discuss about resilience psychology or psychological resilience, we have to discuss types of psychological resilience. So there are, basically there are four types of psychological resilience. The first type is, see, psychological resilience is multifaceted. So it encompasses various strategies and approaches to coping with adversities. To we have when we see the strategies and approaches to coping, we have to also see how many types of psychological resilience are there actually. The first thing is cognitive resilience. Cognitive resilience involves using mental strategies to cope with challenges. So this includes, cognitive means cognition is thinking. So the first thing is positive thinking. So focusing on the positive aspects of a situation and avoid negative self-talk. Next is problem solving, so identifying and addressing challenges in a constructive manner, instead of focusing on the problem, focusing on how to solve the problem. Next is optimism, so believing in positive outcomes and expecting the best. Next is humor, so using humor to cope with difficult situations and maintaining a positive outlook. So, for example, here for cognitive resilience, A person who loses his or her job might use cognitive resilience by focusing on their skills and opportunities for new employment rather than dwelling on the negative aspects of the situation. So learning from the present opportunity and moving forward to the next opportunity. So next type of resilience is emotional resilience. So, emotional resilience is the ability to regulate emotions and cope with stress. So, what does emotional resilience in have is self awareness. So, understanding one's own emotions and triggers. Next is emotional regulation. These steps we have also discussed in emotional intelligence. So, emotional regulation is managing emotions in a healthy way. So, avoiding excessive emotional responses. Next is empathy. So, understanding and connecting with the emotions of others. The next important thing is stress management. So, developing effective coping mechanisms to manage stress and anxiety. Here, for example, a person facing a difficult relationship so might use emotional resilience by practicing mindful techniques to manage their emotions, and also use meditation, to for the emotional control or regulation, and avoid impulsive reactions. So the next type of resilience is behavioral resilience. So behavioral resilience here is it refers to the actions and behaviors that contribute to coping with adversity. That means this include perseverance. So continuing to work towards your goal despite the setbacks. Second is adaptability. So, being flexible and able to adjust to changing circumstances. Next is seeking support. So, reaching out to others for help and encouragement. Next is healthy lifestyle. So, engaging in activities that promote physical and mental well-being. By this, you are reducing stress as well. So, for example, an athlete who recovers from an injury and returns to competition demonstrates behavioral resilience through their perseverance and determination. So, next type of resilience is social resilience. So, social resilience involves building and maintaining strong social relationships. So, it includes social support. So, as I said, having a network of friends and family who provide emotional support and encouragement. Empathy for others, understanding and connecting with the experiences of others. Next is community involvement. So, participating in activities that contribute to the well-being of the community. See, a person who volunteers, for example, a person who volunteers in their community and helps others in need is demonstrating social resilience through their connection to others and their contribution to the community. So these are the types of psychological resilience. As I said, we'll talk about developing, or cultivating so psychological resilience, in detail in the next session. So, thanks for staying tuned. And if you have any queries and you have any suggestions, you can share it in the comment section. Do mention your thoughts on the subject. So I will